So the next muscle that we will discuss is the digastric. The digastric muscle is a small muscle located in the anterior compartment of the neck. It is a part of the suprahyoid group of muscles, and it is so called because of its two distinct bellies. The anterior belly, as you can see here, takes its origin from the digastric fossa on the lower inside of the mandible, and the posterior belly takes its origin from the mastoid notch on the medial side of the mastoid process. So, if you remember when we discussed the sternocleidomastoid, we had seen that the sternocleidomastoid attaches to the lateral aspect of the mastoid process. Here, the digastric, the posterior belly of the digastric, attaches to the medial side of the mastoid process. It is important to keep this in mind because it will help us in identifying the digastric muscle posterior belly on a CT scan, as we will soon see. Both these bellies then get inserted onto an intermediate tendon which attaches to the hyoid bone. So this is how it looks on an anterior view. This here is the anterior belly. These are the anterior bellies, and this here is the posterior belly, and both of them meet at the intermediate tendon which is attached to the hyoid bone. So why is this an important muscle for cervical lymph node contouring? So in this diagram, this muscle here is the mylohyoid muscle. This muscle forms the floor of the mouth, and this muscle here is your left anterior belly of digastric. This is the right anterior belly of digastric that has been cut. So this region over here that lies between the two anterior belly of digastric and superficial to the mylohyoid muscle is your submental group of lymph nodes, or the level 1A group of lymph nodes. This space that again lies superficial to the mylohyoid and lies between the anterior belly of digastric and the posterior belly of digastric. This space is your submandibular triangle, and this submandibular triangle has your submandibular group of lymph nodes, or the level 1B. So this here represents the same thing. So this is the anterior belly of digastric on one side. You can't see the opposite side anterior belly. So this space that is medial to the anterior belly of digastric is your submental space, and this space between the anterior and the posterior belly of digastric is your submandibular triangle. So let's see how to identify this muscle on a CT scan. So this here is the mastoid process, and we have already seen that it takes the posterior belly takes its origin from the medial surface. So let's scroll down. As we go down, you can see a tiny muscle that is starting over here from the medial surface. So this is the posterior belly of digastric. So this muscle is the posterior belly of digastric. It's not very prominent, and it's a little difficult to identify, especially on a non-contrast scan where you can confuse it with blood vessels. So a contrast scan helps, and to identify it, it's always a good idea to start from the origin of the posterior belly. So this muscle here is your posterior belly. So I'm continuing to scroll caudally. So try to identify the muscle on the opposite side also. I have only labeled it on one side. So this is the posterior belly of digastric. So this is exactly where your lymph nodes are, also around the blood vessels. So a lot of times, we can confuse it for a lymph node unless you know that there's a muscle that passes through this part. There's a very high chance that you can confuse it to be a lymph node. So as we go down, you'll stop seeing it. So now we can't see it anymore, but I'll continue to scroll caudally because I now want to identify the anterior belly of digastric. So now you can see here, this is the anterior belly of digastric on the right side, and this is the muscle on the left side. So again, it becomes more prominent as we go down. So this here are the two anterior belly of the digastric on the right side and on the left side, and this space where you can already see some lymph nodes, this is the submental group of lymph nodes, and these are the submental lymph nodes, or the level 1A lymph nodes. So it is a coincidence in this patient that you started to see anterior belly once you stopped seeing the posterior belly. That basically only depends on the position of the neck, so it's not always the case. We'll see another scan. So this is another patient. Now we will start from caudal to cranial. This here is the hyoid bone. So I am going to scroll cranially. So now you can see the submandibular gland on the right side over here and the left submandibular gland. So this is nothing but the submandibular space. So this is the anterior belly of digastric. Again, as I go more cranially, it will become more prominent. So lateral to the anterior belly is your submandibular space, as we already saw. So I'm continuing to go cranially. So this, just focus on the anterior belly for now. So this is the anterior belly on the right side and this is on the left side, and this space that is deep to the platysma and between the anterior belly of digastric is the submental space, and you can see a very prominent submental lymph node over here. So this space again is the submental space. So now let's scroll downwards. So we will scroll downwards now and we will try to identify the posterior belly. Again, this is the mastoid process. So it has to arise medial to the mastoid process. So you can see over here, this is the posterior belly. Compare it with the opposite side. I've not labeled the other side. So this here is the posterior belly. It will move anteriorly as we scroll caudally. So you can see here it's very nicely seen. Again, in this patient, because of the neck position, you can see anterior belly and posterior belly in the same slice. Yeah, so an easy muscle to identify, but we normally don't pay attention to it. I hope this presentation makes it easy to identify this muscle. Thank you.